I'm Sarah. I'm going to be your nurse today. Miss Barkley, first I'm going to note that the whiteboard has the correct physician name and staff on the board, today's date. There's no clutter in any pathways here. You have a water cup on the edge of the bed. No assistive devices. No oxygen, no trach, no Foley, no abdominal tubes. Bed is in the lowest position. 3 side rails are up. And the name band is on and it is correct with her name, birth date, and medical record number. Okay, so Miss Barkley, you came here today from a nursing home, is that correct? Okay, and then can you tell me what brought you in? Some abdominal pain, nausea, vomiting for the past couple days. Okay. And it looks like you've received a CAT scan with some IV contrast. And they thought you might have had a little small bowel obstruction. Okay. Okay, so looks like our orders here are going to be, we're going to put you on telly, get strict in and out measurements. We're going to keep your oxygen saturation above 92%, and we're going to keep you NPO, so you can't eat or drink anything for right now. I have some Vicodin I'm going to give you for some pain if you need it. And then I have Zofran for whenever your belly is upset, feel nauseous, okay? So first, what I'm going to do is we're going to do an assessment on you, okay? Can you tell me where you're at? Okay. And then what's today's date? Good. And then what's your name? Good. Okay. So you set up, look in I have a little light, I'm going to check your eyes. Pupils are nice and round and symmetric bilaterally. 4 millimeters. Face is nice and symmetrical. You smile for me? Good. Stick out your tongue? Good. No facial drooping. Alright, I'm going to sit you up a little bit. Can you turn that way? Good. No JVD. Turn this way? Good. No JVD. Okay. I'm going to go ahead and take a listen. Listen to your apical pulse for a full minute. And then just breathe normal. S1, S2 are present. There you go. Sit up for me. Good. Nice breaths. Alright. On a scale from 0 to 10, what would you rate your pain right now? Okay, a 6. Where's it at? In your belly? Okay, let's take a look. Alright, so flat, non-distended abdomen. I'm going to take a listen. Active bowel sound, active bowel sounds. In all 4 quadrants. I'm going to press on your belly. Sorry, this side first. Any pain or tenderness? No. No guarding. Okay. Any pain with urination or any increase in frequency? Any vaginal discharge or discomfort? Okay. When was your last bowel movement? 4 days ago? Okay. Alright, go ahead and grab my fingers. Squeeze. Good. Pull. Good. Push. Pull. Check your cap refill. 3 seconds. Or less than 3 seconds. Which finger am I touching? Good. Which finger am I touching? Good. Any numbness or tingling anywhere? No? Okay, good. Skin is nice and warm, dry, nice elastic turgor. Let me check your radial pulses. Good, radial pulses are nice and even bilaterally. Check your feet here. Check your pedal pulses. Good, nice and even and bilaterally strong. Which toe am I touching? Good. Which toe am I touching? Good. Less than 3 second cap refill on both lower extremities. Any numbness or tingling in your toes or feet? No? Okay, good. Alright, so let's go ahead. It looks like I'm going to, let's see, the STNA came in and wrote down your vitals that she just got not too long ago. Heart rate was 103, respiratory rate was 16, blood pressure 118/68, oxygenation 96%, and then the pain, which we just talked about, was 6 out of 10. So I'm going to go ahead and get your medication. I think that will manage your pain a little bit more, so then that pain can drop and you can feel a little bit more comfortable. Does that sound like a plan? Okay, good. Alright, I'm going to go ahead and it looks like here we have a prescription, an order for hydromorphone, 1 milligram per 3 times a day as needed for pain, so moderate to severe pain. So, Miss, do you have any allergies to medications? No? Okay, good. I'm going to have you give me your name and date of birth. Okay. Good, and then we're going to check the medication versus the order. Right medication, right dose, right route. And it seems that my nurse manager came in and started an IV site on her, so I'm able to give this IV push over 2 to 3 minutes. This is diluted down with 5 milliliters of sterile water. So I'm going to draw up 5 milliliters, which will equal 1 milligram. So I have my syringe here. Open up my syringe, pop the top, wipe it off with a swab. Swab off the port or the hub. Okay. And then I'm going to withdraw 5 milliliters of air, inject it into the vial, then I'm going to withdraw 5 milliliters of solution, being sure there's no air bubbles. And we're going to inject this slowly over the course of 2 to 3 minutes, noting any redness, any decrease in respirations. Okay, so I'm going to come back in and check on you every so often. Be sure you're not getting too sleepy. This medication can cause sleepiness, drowsiness, some dizziness, maybe confusion, some constipation, okay? If you feel like you're getting too sleepy, let me know, and I'll come in and check on you, okay? All right. I'm going to wash my hands. Knock, knock, knock. Alright, it's been a couple hours now, so I'm going to grab my computer here, and we're going to look at some information. Vital signs from the STNA are in here. Heart rate 96, respiratory rate 22, blood pressure 147/80, oxygenation is 93%, and pain is 3 out of 10. So the pain's gone down, oxygenation's gone down a little bit too, and your heart rate's gone up a little bit. You haven't gone to the restroom all day, so let's go ahead and get up and try to go. Nice and slow, I'll help you. Okay. Alright. and you voided 200 milliliters of dark urine. So I'm going to go ahead and document this here real quick. Okay, I'm going to let the oncoming nurse know that as well. And I will inform the doctor. I'm going to assume that he's going to be ordering some lab work, basic metabolic panel, and it's kind of like to see how well your kidneys are working since that's such a low urine output, okay? And here I see that we have a 500 milliliter bolus of normal saline, so I'm going to go ahead and hook that up. Wash my hands, put gloves on, and spike my bag. Be sure there's no air in the lines. Air in the line. I would have flushed that IV push medication also. Grab my swab off the hub, hook that up, and set it for an hour, 500 milliliter bolus. Labs here, they're going to go ahead and draw some blood. I'm going to keep looking at the computer and chart, okay? Okay, I'll come back in a couple hours and check on ya. Wash my hands. Alright, knock, knock, knock. It's been about 6 hours now and there's not been any more urine. You haven't gone to the bathroom yet? Okay, and I see that somebody came in and did a bladder scan on ya. 60 milliliters of urine is left in the bladder. So I'm going to go ahead, check you out really quick, listen to your lungs. Wash my hands, of course. Okay, we're hearing some crackles bilaterally. Okay. And your oxygenation is at 89%. So I'm going to go ahead and put an oxygen on you real quick. Just goes over your ears and your nose and it's going to tuck down underneath your chin, okay? And it's on 4 liters. Just breathe in through your nose normally like you would, okay? Your renal panel has come back. BUN is increased. Sodium, 132. Creatinine, 3.6. Calcium, 7.7. GFR is 47. Phosphate, 4.8. Potassium, 5.5. Magnesium, 1.4. I'm going to go ahead and notify the physician about these labs. I'm going to assume that he's going to give us an order to give you some more fluid and maybe a diuretic to get some of that fluid out of your lungs, okay? I think right now what's going on is with your contrast, IV contrast that you had with your scan earlier, and no fluids throughout the day, probably caused some damage to your kidney, which we call an acute kidney injury. And then on top of that, not drinking anything probably worsened that a little bit, okay? So what we're trying to do now is we're trying to restore function to your kidneys, nice and slow, okay? So hopefully things will be turning the corner. I'm going to go ahead and report off to Michelle. Michelle, this is Miss Barkley. She's 64 years old. Came in, had a CT scan done with IV contrast. She had a small bowel obstruction, okay? Was NPO, didn't have any IV fluids. Urine output dwindled to 200 milliliters, very dark, concentrated urine. Bladder scan revealed that she had 60 milliliters of urine left in her bladder. Crackles bilaterally in the lungs. Renal panel was elevated. GFR was decreased. So we're looking at an acute kidney injury going on. She has hooked up to, she has a 500 milliliter normal saline bolus going for an hour, and I'm anticipating the provider order some more IV fluids. Okay, do you have any questions for me? Okay, alright, see you tomorrow.